successful implementation and achievement of our project goals. Thank you.
Let us give another round of applause. She said, health is not the core area of mandate. It is amazing the things, even though health is not the core area, the German development people are doing. We will now call upon the representative Dr. Kaba to give us the general speech.
Good morning, everybody.
Good morning.
First of all, let me apologize to you all because I have another duty this morning at 11 o'clock and we have scheduled to be here around 9 o'clock, so I'm already late, so without apology. As he said, Mr. Chairman, dignitaries of the High Table, organizers of this special congregation, fellow Ghanaians and partners, distinguished guests, and that includes everybody. I say to you, good morning.
Good morning.
I am humbled to be here with you. I stand before you on behalf of the Director General of Ghana Health Service, Dr. BIENNIAL. Mr. Chairman, the concept of preventive healthcare existed before the 20th century biomedical revolution. Long before the advent of scientific investigation into disease processes, men were explaining diseases and attempting to avoid illnesses. In surveying historical efforts to prevent communicable diseases, three categories of prevention are apparent. One, individual control over personal health through adherence to dietary and hygiene codes. Two, social control over health by means of isolating diseased individuals or protecting large groups of people from environmental dangers. And the third one is application of increased scientific understanding of disease. Medical men, as you and I, have always been sanitary reformers, yet the customs of society have sadly misplaced our duties. In practice, the physician is called to cure diseases. His efforts are now directed first to save life and second to prevent damage to the system. But one fact in every case of known sickness is always that at one period the disease might have been prevented. Mr. Chairman, history is more than the path drawn by the past. It influences the present and can shape the future. 35 years ago, following the declaration of the primary healthcare concept in 1978, Ghana's priority for health intervention shifted towards primary healthcare, leading to the subsequent establishment of Ghana Health Service and teaching hospitals in 1996 by an Act of Parliament known as Act 525 of 1996. Ghana Health Service has been structured to effectively and efficiently address issues of both clinical and public health concern. The evolution of public health and preventive care is subject with many phases. At the regional and district levels, curative services are delivered at the hospitals, and public health services by the district health management team, as well as the public health units within the hospitals. At the sub-district level, both preventive and curative services are provided by the health centers, as well as outreach services to the communities within their catchment areas. Basic preventive, promotion, and curative services for minor ailments are being addressed at the community and households level with the introduction of the community-based health planning and services, commonly known as GIMPA. The role played by the traditional birth attendants and the traditional healers is also receiving national recognition. Over the past 2 decades, the health sector has opened up to a wider range of providers at the regional, district, at the national, regional, and district levels. The districts have a sub-district level policy guidelines to strengthen community participation in decision making, health programs planning and implementation. Over the years, the The Public Health Division has dedicated its efforts to disease prevention. Departments include, but not limited to, Health Promotion Unit, Disease Surveillance Unit, Infectious Disease Control, Non-Communicable Department, Immunization, and just yesterday we had the End Polio campaign launch. There also exists the program-based activities, including HIV, TB, yaws, guinea worm, urolic ulcer, hepatitis, and of course, malaria, among others. Ladies and gentlemen, times have changed, and so we must also do. We cannot address the 21st century problems with 20th century bureaucracy. Today, our nation is confronted with a mixed bag of diseases, communicable and non-communicable. This calls for a new approach in health delivery and collaboration. The yearly cholera outbreaks have clearly demonstrated the need for multi-sectoral involvement in its prevention. The recent outbreak of Ebola in neighboring countries has defined the One Health concept and the need for interministerial collaboration. Mr. Chairman, the life of every generation, the spirit of hopefulness, sacrifice, togetherness, unity over division must come true if we want to make our mark in history. These interagencies and interministerial approaches to disease prevention must start and be strengthened within the health sector. Ghana Health Service is therefore calling for a seamless health system and has taken the steps to sign MOUs with CHAG, teaching hospitals, Sanford International Clinic, and looking forward to do the same with the private sector and GAC, and any other form of service delivery, including traditional health, for better service delivery. We have come too far. We have seen so much, but yet a lot to do. In the end, in this meeting today, if we turn not from each other, or if you turn not on each other, but towards one another, then we together can listen to the mighty voices of the articles of millions of citizens relying on us to survive. With my faith cemented in God, I wish you a successful Congress, and thank you very much. God bless you.
Thank you very much. Prof. Chairman, the President and founding members of GAQHI, the representative of the Deputy Minister, Dr. Kwadame, representative of GIZ, invited guests here today, members of the media fraternity, and all inclusive. Bridging the equity gaps in private access to health services as a pathway to addressing the widening inequalities in health outcomes remain a health sector priority. And this involves disease prevention and health promotion strategies, which are key to improving population health. Hence, GAQHI'S quest to integrate preventive care into Ghana's healthcare delivery system remain a shared goal of all agencies of the Ministry of Health. For the Christian Health Association of Ghana, CHAG, the provision of holistic care to the human person, which comprises curative, promotive, rehabilitative, and preventive health services, is an integral value and a sacred responsibility. Prof. Chairman, evidence and experience show that most of the deaths, diseases, and disabilities in the Ghanaian healthcare system are avoidable. Undoubtedly, therefore, there is a robust socioeconomic case for disease prevention and health promotion interventions across the board. In an era of financial sustainability challenges confronting the health sector, placing a higher premium on preventive care will be indispensable in keeping rising healthcare costs under control. Indeed, the pathway to achieving the health-related sustainable development goals could be conscious investments in public health for shared broad benefits. Prof. Chairman, mainstreaming preventive care will require structural changes in the health system, as well as reorientation of our collective mindsets. We need to respond to urgent questions if we are to deepen and embed preventive care into the Ghanaian health system. Therefore, I pose a few questions that should prompt our intuition as we deliberate on the best way of integrating preventive care into the Ghanaian health system. One, how do we measure the achievement of service providers? Is it a number of cases diagnosed and treated, or number of disease episodes prevented? Indeed, our performance management models and structures recognize disease treatment of disease other than prevention of diseases. Secondly, how do we value healthy life gained or quality of life adjusted that's attributable to preventive care? Thirdly, how do we persuade patients that the best care is not necessarily the number of medicines or drugs prescribed or dispensed per encounter? Is our health system set up to provide health or to treat diseases? I'll pose the question once again. Is our health system set up to provide health or to treat diseases? Are preventive services available, accessible, and affordable? And finally, are there incentives for health service providers to integrate disease prevention services or health promotion activities into the service delivery system? Indeed, we can deliberate on a national health insurance scheme that incentivizes diagnosis and treatment of diseases other than prevention of diseases. If you prevent diseases, you will not be paid. But if you wait for disease episodes to occur, you will be rewarded handsomely. From Chairman, ladies and gentlemen, it is apparently intuitive that preventive health services are feasible options for improving population health. Nonetheless, this adoption and integration into the healthcare system will require some choices and investments with long-term use. Therefore, as we debate, deliberate, and discuss innovative ways of integrating preventive care into the Ghanaian healthcare system, CHAD wishes to assure GAQHI of our support and solidarity in placing preventive care on a higher health policy platform. CHAD will be pleased to cooperate and collaborate with GAQHI in mounting a focused and forceful policy response in our collective quest to integrate preventive care into the Ghanaian healthcare system. Congratulations, the fourth biennial conference, and God bless. Thank you very much.
Mr. Chairman, representative of the Honorable Minister of Health, Dr. Dami, founding fathers of GAQHI, the President of GAQHI, the media, or other protocol observed. I am an executive member of the Association of Health Service Administrators, Ghana, representing the president of my association at this very important gathering of Ghana Association of Quasi-Government Health Institutions. Our purpose is to extend our felicitations to and wish them a very fruitful, dispassionate discourse for the betterment of our beloved country in general and the quasi-government health institutions in particular. We of ACCRA are proud of GAQHI, not only because of what it stands for, but also because some of their members, including but not limited to their president, are members of my association. And hence, one can say with a fair margin of certainty that GAQHI and ACCRA have something valuable in common. While we wish them healthy deliberations, it is our ardent hope that they will use this platform to further do deep thinking outside the box, so as not to just scratch the surface of the root causes of some of those challenges confronting the public health sector of Ghana, but also to come up with long-lasting solutions that deal with the root causes of those challenges. We are enthused beyond measure that the 2015 GAQHI Biennial Conference is under the theme Integrating Preventive Care into Ghana's Health Care Delivery System, GAQHI'S example. This is because ACCRA buys into integrative healthcare delivery approaches that synergizes both preventive and curative healthcare. Brothers and sisters, integrating both aspects of the health spectrum fosters parallel program implementations and its accompanying wastage of human, financial, and material resources. It has been anthropologically observed that man is not a plastic object on whom the environment works his will, but rather man is a geomorphologic agent occupying areas of the earth not passively, but as active factor in change. Similarly, we entreat GAQHI to take astute and transformative decisions at this meeting for the ultimate benefit of humanity. Mr. Chairman, one lawyer by name Morrison once said, to a zoologist, a horse suggests the genus mammalian cradle. To a traveler, a means of transportation. To an average man, the king of sports. To certain nations, an article of food. Suffice it to say that herb means different things to different people, but we are convinced that herb means a valuable developmental resource and a basic need to GAQHI. And hence they take health delivery very serious. While we of ACCRA wish GAQHI well at this meeting, we suggest that they propagate their good practices. That is the GAQHI'S example of integrating preventive and curative healthcare, so that other health institutions in the country can emulate and implement similar strategic interventions for the benefit of their clients. Long live GAQHI, long live ACCRA, long live Ghana, and may we collectively aspire to inspire before we all eventually aspire. Thank you very much.
I want to thank the executives of the GAQHI for inviting me to make another presentation to the group. And I want to walk you through a few slides just to give you a perspective of what exactly we are talking about. But fortunately for me, the two initial presenters, the one from Novartis and dementia, the one on dementia, I mean, I actually made my work easy because they've actually provided a justification why this project is paramount and important. If we are going to spend 185 Ghana cedis a month, one person, on diabetes alone, management, I mean, forget about the other tangential costs that you incur, then I think we are doing ourselves a disservice if we do not actually take this project seriously. And so I want to thank you for even changing the theme for your AGM itself and made it this team, prevention is better than cure team. I mean, and I think I appreciate it. I also want to appreciate GAQHI for the enthusiasm they've actually put into the project. It's amazing how they are literally chasing the funders and almost everybody to let everybody know that they need business. And can we actually give them yeah. This is a follow-up of what has actually happened since July 5th of this year, even though the initial actions that have been you've been informed started somewhere in 2009. But I'm talking about when the project itself was approved. I mean, all those things were presented. It was launched officially in Royal Fiesta. A number of you were around in July. And just within the following weeks, we all met together with the partners to develop a strategic program of action to see how to move this thing forward. I mean, people talk too much without much action. And this is just an example of what this project is actually about. The following week, the GAQHI executives actually made the idea to go through the program of action one by one to develop a milestone so that everybody is aware of what needs to be done. And part of the POA actually involves all the partners sensitizing their various levels of management. And that is what GAQHI has actually done in a very, very, very systematic way. And hence my request for you to clap for them. Just in 26th of August, we met at the hotel with CEOs and senior managers of quite a number of the GAQHI institutions for their first sensitization sessions to happen. And already we have the buy-in of your CEOs and senior managers. Well, what is happening today is also another opportunity to move from the top senior managers to the institutional managers themselves, so that you are actually abreast with what is what the project entails, so that you give your support to that. Can we have and so in this brief presentation, we are going to ask ourselves, why should I be interested as a GAQHI facility? Now, not collectively. We've moved from the collective into you as an institution. I mean, one of the GAQHI institutions is a VVRA hospital. Why would I be interested as a VRA management of the hospital itself, not the larger VRA? Now, I mean, why should I spend my time? What is involved? The roles and responsibilities of the various partners, expected roles of the management at that facility, and then a few concluding remarks. Can I have the next slide? Last week I made a presentation and I showed this slide, and it was on the role of health promotion in the health system. And I'm tying it to this presentation because you cannot neglect the entire health promotion aspect to what we are going to do. If we look at the outcome side, the very last section, we talk about the coronary heart disease, stroke, diabetes, peripheral vascular disease, cancers, and other things. That, unfortunately, is where the medical focus is. I mean, we spend almost all our time doing the cardiac bypass surgery and almost all the treatments we have with the new the drugs, and we will keep on changing the new drugs, and we will keep on changing the new drugs. And that is because we are looking at the outcome side. If we are lucky, we will move probably one step backwards to look at the intermediate factors. And for some of them, the remedy is to use drugs on excess body fat, BP, glucose intolerance, blood lipids. But that will not make people healthy. And somebody asked that question. That are we treating or improving health? That's the answer. Because if we are going to focus only on the 1 and 2, then unfortunately we are those who claim to be well will come back. Why not move backwards into the modifiable health behaviors? And where you are now addressing some of the lifestyle issues that have to be addressed. Because unless you do that, you are just wasting everybody's money and effort. But even that alone will not make people healthy, the larger society. So we have to even move backwards into the globalized world. All the community, social, and cultural norms and other systems that impinge on the other. And so it's a collective integrated package of things that come together to make people healthy. And that is the essence of what we are doing. What we are doing well, we think that it's not enough, we have to do something else. Can we move forward? And so, basically, the GIZ, through one of their program supports, they decided to now come together with some STA partners, strategic alliance partners. Initially, they were just about 5 or so. A few keep on being added to develop a 3-year program where we are now not only going to talk about prevention is better than cure. That is known long ago. Everybody knows about that. But how do you institutionalize it? That is the issue. And the goal is basically to reduce preventable diseases in employees of STA partners, companies, their dependents, as well as the catchment areas, through the introduction of preventive and health promotion measures, which unfortunately is not currently being addressed in a systematic way. So the objective is quite simple. We want to achieve a better integration of preventive measures, including HIV integration, into the service packages of both public and private health service providers and public and private health insurance providers in Ghana and beyond. That basically is the whole essence of that. I mean, in addition to the curative services, we are actually targeting these 3 groups of people. First is the employees of the STA partner companies, for instance, your hospitals, their families, and the surrounding communities. They will be the primary targets. And then the second will be the health service providers themselves. And we are using GAQHI facilities and institutions as the key agents for this. Later on, the public sector institutions, and I'm sure START will also come on board, and that will be quite okay. But we are not forgetting that preventive services are not included currently in most private health insurance and even in the public health insurance systems. And so they are also a target. And that is why private health insurance companies and even the National Health Insurance Authority is also going to be targeted. And that is one of the reasons why I asked you to stay, so that you convey it to the minister, because the Health Insurance Authority is supposed to come under the ministry. Some of the partners are listed here: Nationwide Mutual Health Insurance, Revival Insurance, Golden Star Resource, NMS Infrastructure, 690, Around Health Institutions, and the Ghana Community Network Services. They are the partners. Then the others like GAQHI are the beneficiaries. And so you technically, as far as the alliance is concerned, you are not a partner because you haven't provided funding for that. But you are the main beneficiary to the projects. And so that is basically the issue. Why should I be interested? Some of the answers have been provided, but in a very systematic way, as we have said, currently African health systems are focused more on curative rather than on preventive services. And available preventive services, we cannot ignore that there are some already in place, are ad hoc and are not systematic. And the focus is actually on the systematic introduction of preventive services, just as we do systematic provision of curative services, in our facilities. And so the rationale is that introducing preventive measures, even though appear to be not very expensive, but if you leave individuals on their own, they will not be able to do that. And so they need support for them, especially the vulnerable, the elderly, and infants. And that is why the negative effects on the national health system in this totality and the economy is a lot. It's huge. It's huge. The next slide. The advantages are for the institutions, for the individuals, and the insurance companies themselves. The first one is obvious. The long-term disease burden related human resource costs will definitely be minimized. But whether we like it or not less than 10% of the population, adult population in Ghana are diabetics. As I speak, in fact, most of them, it will even be higher in a number of states. Almost 25% to 45% of all adults, civil servants, are hypertensive. And quite a number of them are on drugs. We are actually in an epidemic, and the unfortunate thing is that once it develops, it's going to be lifelong. There's no way, unless the things change, I have to be probably on drugs for the rest of my life. The cost implication is huge. Apart from the cost, the productivity aspect. If you are the head of an institution and almost 1/10 of your staff are coming for excuse duties, they are not even coming for the refund of their medical bills. That is another thing. But they are sick, they can't work. They are not available. And you have to think twice and say that it's not because they are truants. They are just sick, and so they have to go for a checkup. And so the effects in terms of healthcare, absenteeism, disability, and overall productivity is huge. And if we don't do anything about it and pretend that everything is okay, I tell you, in the next 10 years, we will definitely be in trouble, especially as a developing country. The other benefit is that if your institution is able to institutionalize such a system, the very improvement in the quality of care, you raise the institution's image, and the employees become content because they know that at least the management cares about them, and that is very important. At that point, best practice attracts more funding. We keep on saying that there's no funding in the system. But almost all the development partners, what they want to see is success stories. They will be chasing people for success stories. And so your small hospital somewhere in the village will become a mecca, by almost all the international partners. Because they want to see whether something like this is feasible, is practicable, and then the evidence is there. They come, a little proposal is developed, and then you get additional funding. not only from GIZ now, but they will come from many other parties. That is basically what is happening. For the employees themselves, the workers, health workers themselves, the advantage is obvious. I mean, they are spending less money on healthcare, even beyond the money that is refunded by the hospital. Their morale will be quite high. And for the insurance packages, where the insurance companies, whether you like it or not, you have to bear long-term insurance costs that it will come down. It's an advantage for an insurance company to invest also in preventive care. And I keep on telling them, National Health Insurance Authority, that if you want to reduce your bill, medical bill that you are paying for, in the long term, you may have to probably invest in some preventive things. And an additional advantage is that the mere fact that you are part of that partnership, will increase the registration with your insurance company. I mean, that is also a gift. So it's again a win-win situation for the employers, for the employees, and the insurance companies. If we are able together to move and partner the next slide, and definitely the Ministry of Health itself, if you want to, if you are a Ministry of Health and not a Ministry of Diseases, then for obvious reasons, you also be paid. But the fortunate thing about these things, the gloomy picture I've painted, is that we can do something about it. I mean, internationally, the strategies to do this, they are not rocket science or atomic energy science. I mean, where you say you can't do this or that. No. It has been implemented in a number of places in a smaller scale. Even in Ghana, I'm going to call Ashanti. I mean, 2012, 2011, they did their own study. They looked at the data and saw that an average of 3 days were being taken off work per person for malaria alone. Just looking at their own data. They recognize that no, that cannot happen. And so they introduced this a number of preventive measures, including the IRS, indoor residual spraying for malaria and other things. And they were able to reduce their cost by 70% in 2 years. As a company, not even as a